Hello everyone, my name is Azadeh Foruzande and I am talking about my project, which is about how can the healthcare system obtain a culturally sensitive care for transgender patients. The reason I picked this topic is that transgender population faces numerous barriers in the healthcare, which results in underutilization of healthcare. 61% avoided medical care because of this reason, and health disparities for this population. Barriers that make them avoid receiving appropriate care contribute to increased risk of certain types of cancers, substance abuse, and chronic disease. There is a need for annual transgender competency training and boundary training. This need trains the healthcare staff to understand how to approach a transgender patient and to be accountable for transphobic responses. The reason I chose this project of training for ultrasound department is the necessity for ultrasound technicians to know, because they perform pelvic ultrasound, and the example is that when there is a female pelvis, which is different with the male pelvis, the ultrasound tech needs to know the background of the patient, and they need to know what exactly to ask and what not to ask. For example, if there is a female transgender and you are examining the bladder, you should be aware that if the patient is in transitions, the prostate is still there, and they should evaluate prostate as well. And if there is a male transgender, they should be aware that the patient has uterus and ovaries, might be having uterus and ovaries, and they should evaluate those organs as well for any pathologies. So they need to know how to approach these cases. Summary of the project would be in 3 parts. First is educational and training sessions for ultrasound department staff, which is gonna be doing through the PowerPoint presentation. It is going to be including introduction and background, which is talking about the necessity and importance of this training, and then how to make transgender unfriendly, and how to avoid the transgender unfriendly environment, and then gender identity and sexual orientation concepts, and do's and don'ts about when they approach a transgender patient. The next part is the analyze, which is a pre and post surveys. And then the third part is the conclusion and report. The steps needed to accomplish the project would be, the first step would be approval of the department manager for this opportunity to the training sessions. And then the second part is to analyze the situation, which is done through the pre-session surveys, and this surveys is going to be distributed to the staff, and I'm going to evaluate their concerns and what they need to know, and what are they so uncomfortable with. And the next part is the training session, and after the training session there would be the analyzing of the results through the post-session surveys, and then at the end the report. Resources and useful BAS courses that I'm going to be using. So for my resources, I'm going to use Department Manager for all kinds of coordinations of the training sessions. And then I'm going to be using Writing Specialist and Librarian a lot. My mentor and my capstone instructor is going to be really helpful for me. And the useful BAS courses would be Intercultural Health Communication, which is Communication 330, which helped me a lot about having different perspective about different cultures or different group of patients, and the importance of having a culturally competent healthcare system. Thank you for your time and attention.